Today, New Zealand's total number of new COVID-19 cases is 5, made up of 2 new confirmed cases and 3 probable cases. All of these new cases are linked to existing cases. The new combined total of both confirmed and probable cases in New Zealand is 1,445. Sadly, today I am reporting the death of a woman in her 70s who had COVID-19 infection. This woman was one of 6 residents from St Margaret's Hospital and Rest Home in Te Atatu in Auckland, who has been transferred to Waitakere Hospital on April 17. The woman, who had an underlying health condition, died yesterday. Our thoughts are with this woman's family and friends, and we ask that their privacy is respected at this difficult time. Now, residents were transferred from St Margaret's as a number of staff were in precautionary and continue to be in precautionary self-isolation following close contact with people who are confirmed COVID-19 cases. And this has impacted on the facility's ability to maintain full staffing. And so, in addition to those 6 residents who were transferred to Waitakere Hospital because they had COVID-19 infection, a further 9 residents from St Margaret's were transferred to North Shore Hospital on 18th of April. These residents are not COVID-19 positive, but are considered close contacts, so are being monitored as well as receiving the usual care they would have if they had been back at St Margaret's. There are now 1,006 cases of COVID-19 who have recovered, an increase on 32 yesterday. Today there are 12 people in hospital with COVID-19 infection. This includes 3 in ICUs in Middlemore, Dunedin and North Shore Hospital. I'm pleased to say that none of these people are in a critical condition. There are still 16 significant clusters and 4 more cases have been linked to extant clusters, including 3 of the cases we're reporting today. In terms of testing, yesterday there were 3,203 tests processed around the country, and the new total is now 89,503. The stock and supply for testing is still over 83,000 complete tests. And just a word on testing, and we will put these graphs on our website after today's stand-up, but we're seeing from ESR reporting surveillance of what is called influenza-like illness, that calls to Healthline and our monitoring of ILI through HealthStat, which is through general practices, and through the Flu Tracker app, as well as our monitoring of what are called SARI, severe acute respiratory infections in hospital, have all plummeted, as we might expect over this last 3 to 4 weeks. And that explains, that's a very good reason for why our testing has dropped, because there simply is not are not people out there who have got respiratory symptoms. However, I'm still pleased to see that we're processing over 3,000 tests a day. We will continue some community-based testing this week, and in particular that's happening in Tairawhiti, in Taranaki and in Northland. And I know in Tairawhiti, and you can see this on their website, during this week there are mobile clinics around Gisborne from Monday to Friday, and starting today some mobile testing moving its way up the east coast to test those more rural communities.
Under Alert Level 3, most children and young people will be continuing distance learning. Early learning centres and schools will be physically open for students up to year 10, for the families that need that. But children who can stay home should stay home. At-risk students and staff, including those who are over the age of 70, should also stay home, and they will be supported to do so. Residential and special schools will not reopen in the early stages of Alert Level 3 for children to physically attend. They may reopen later during Alert Level 3 if public health measures can be managed, and we are working through that at the moment. In the meantime, teachers and staff will continue to support these students whilst they remain at home. Things like the intensive wraparound service and OARS specialists continue to work with those students whilst they are at home. Education for students in years 11 and to 13 will continue remotely. For tertiary education, moving to Alert Level 3 means remote learning will continue, but where that's not possible, some facilities may reopen, with strict physical distancing rules in place. Students in hostels, halls of residence, or self-contained flats can stay there, again with strict rules. But if students went home to join their family bubble, they must stay home. They cannot return to student accommodation whilst we are at Alert Level 3. Providers are contacting their staff and students directly with more information, so they should be the first port of call for parents and students with questions. To prepare schools and early childhood centres to reopen next week, from today we are allowing people to enter schools and early learning services for the purposes of cleaning, maintenance and any other essential preparations that are required for them to reopen for a teacher-only day on Tuesday the 28th of April. We expect most children who need to attend will be able to attend from the 29th of April. I do want to caution though, it may take a bit longer for some schools and early learning services to be ready, and the Ministry of Education will be working closely with all of them. This is not a normal situation, and we will need to be doing things differently. The Ministry of Education has been meeting with sector groups to work through all of the practical issues. Over the last week, the Ministry's kept in close contact with the Early Childhood Education Advisory Group, and this will continue as we continue to work through the key guidance that's needed to support the early learning sector. We've also met with various principals groups around the country and with sector leaders, and will continue to do so. Discussions with the sector will continue as more detailed advice is released over the next week to support schools and early learning services. Our approach to reopening the education system is based on the latest public health advice. I know that physical distancing will be very difficult with children and young people, particularly the youngest children in early childhood education. We've reached the point where the Director General of Health is confident that there is no widespread undetected community transmission in New Zealand. So the chance of it coming through the door or through the gate in the first place is low. Keeping in mind that there are some 400,000 people going to work under Alert Level 3, just as we need to keep them safe, we're putting in place measures to keep children and teachers safe. At Alert Level 3, the approach in an ECE or school environment is designed to limit the number of people that children have contact with. All of the evidence does point to children having lower risk of getting infected and being affected by COVID-19, and it's possible to ensure that children are within the same group each day and that there is no mixing between groups. To be clear, it is safe from a public health perspective to have a group of children learning together. Parents can have confidence that the proposed approach is designed to keep children and their families and their teachers safe. It's really important, though, that parents fully support this approach by doing their bit. Keep children home if you can. Definitely keep children home if they are unwell, and seek medical advice about whether a child may need to be tested. Strictly maintain your family bubble outside of schools and early learning, and ensure that great hygiene practices are observed at all times. Our return to education, along with our restarting our economy, is largely on par with what we're seeing around the rest of the world. Although New Zealand is within a handful of countries in the enviable position of being able to transition out of lockdown and through the alert levels, so we must take the best position for our own needs. Distance learning is going to be with us for some time, for at least another 3 weeks, and I'd like to give you a brief update on the rollout of the distance learning program. We've started the distribution of 6,700 internet routers to households. Initially, those are being prioritised to schools that have students doing NCEA in deciles 1 to 3. We've also had 10,000 devices being distributed by schools to students. More than 1,250 internet-ready computers, that's either Chromebooks or laptops, have been shipped to students so far, and an additional 4,500 have landed in New Zealand and are being prepared for shipping. Again, the priority is NCEA students in levels and deciles 1 to 3. We have further equipment waiting to be shipped from overseas. In terms of the hard packs of materials that are going out to those who don't have access to digital devices, I can confirm that so far we have sent out 80,000 packs in English and 10,000 packs in Māori. And we know that people are tuning into our TV channels to see familiar faces like Susie Cato on the box. The latest information we've got is that 649,000 people tuned in during the first 3 days last week. The parental pages from the Ministry of Education's website had over 100,000 visits over those 3 days. So I want to thank the profession for their goodwill and their professionalism. To teachers, principals and centre leaders, they've got an important role to play in getting New Zealand back on its feet. I know they know that, and I want to thank them for it. So finally, to all of the parents out there who I know are juggling working from home, caring for your kids, my message to you is the same as it's been since the beginning. Be kind to yourself. We are not expecting parents to completely replace the classroom environment at home, so be reasonable in your expectations of yourselves. These are extraordinary times, so thank you for your understanding. We're doing our very best to minimise the impact on children's learning and on their well-being as we work together to keep New Zealanders safe.